I'm Susan Taylor with Scripps Health in San Diego, California. You're going through your normal day, and then all of a sudden you become a little dizzy, can't walk, having difficulty speaking, might be numb on one side. You might be having a stroke, and it is critical to your survival to get to the ER immediately. How do you diagnose and treat a stroke, and can you prevent it? Joining us is Dr. Mary Kalafut. She's a neurologist with the Scripps Clinic Medical Group in La Jolla, California. She is the stroke medical director for the Scripps Health System. Doctor, thanks so much for being with us.
My pleasure.
So, doctor, what is a stroke and what causes it?
So, a stroke is a lack of blood flow to the brain. So, what happens is that one of the blood vessels gets closed off by a clot that prevents blood from getting through the blood vessel into the brain. So, then what happens is that with this lack of blood flow, these nerve cells die and result in disability, whether that be weakness on one side of the body, inability to speak, or unsteadiness. Many things can cause this type of clot, whether it's a little piece of cholesterol breaking off from one of the blood vessels in the neck and going to the brain, or it can be a clot inside the heart going from the heart to the brain.
And talk about a little bit more about the symptoms of a stroke.
Everything that we do is controlled by the brain. Many things can be manifested by a stroke. But typically the most common things are weakness on one side of the body, numbness on one side of the body, unsteadiness, or difficulty speaking.
How many people suffer a stroke every year, and how many people pass away from a stroke?
So approximately 800,000 people suffer a stroke in the United States every year, and more than 100,000 people pass away from a stroke on a yearly basis in the United States.
And I referenced it in the intro. Time is incredibly critical in diagnosing a stroke. So talk about if you have these symptoms, why do you need to get to the ER as quickly as possible?
Yes, this is a very important point that you make, Susan, because with the lack of blood flow to the brain, nerve cells start dying. And the longer that we deprive the nerve cells of oxygen, the more likely you are to have permanent deficits. So the important thing to do is if you are noticing signs or symptoms of stroke, you call 911 and get into the emergency room immediately, because we do have treatments that can reopen the blood vessel and restore blood flow.
And you want to call 911 to get to the ER. You do not want to drive yourself to the ER.
Correct. That's very important. You don't want to drive. Going by 911 is the best way to get appropriate treatment that you need.
Talk about Be Fast. What is that?
So Be Fast is a mnemonic that we use to help us understand the signs and symptoms of stroke. So B means balance. So if all of a sudden you're unsteady, you can't walk, that would be concerning. E means eye. So whether that means you lose vision or you develop double vision all of a sudden, that would be a sign of a stroke. F means face. So you would look at your face and smile and see, is there any difference between the two sides? Does one side not come up as much as the other? A means arm. So what we ask you to do is extend the arm straight out there. And if one doesn't come up or starts going down, that's a concern for a stroke. S means speech, whether that means you have slurred speech or you're using the wrong words, that could be a sign of a stroke. And then T, most importantly, is about time. So it means that you need to call 911 so you can get treatment right away.
There are different types of strokes?
Yes, so there are two major types of stroke. One is called an ischemic stroke. So again, looking at the brain itself here, these blood vessels, if one of them is closed off, and there's a lack of blood flow, that's ischemia, okay? But sometimes the blood vessel can break open and blood seeps out, and that's called a hemorrhagic stroke. So those are the two most common kinds. We do know that 60 to 70% of the strokes are ischemic and the remainder are hemorrhagic.
What is the connection between heart disease and a stroke?
Yes, so there are many overlaps between cardiac disease and strokes. So sometimes people can have an irregular heartbeat, something called atrial fibrillation, that can cause a little clot to form in the heart and then go from the heart to the brain. So it's important to be on the appropriate medications for prevention if you do have that type of irregular heartbeat.
Who's at risk for having a stroke?
So, risk factors for stroke include patients that have diabetes, patients that have elevated blood pressure, especially if it's not well controlled, patients with elevated cholesterol. Of course, people that smoke are at the highest risk, and people that excessively drink. So, those are the most important things that can cause a stroke.
What tests are used to diagnose a stroke?
So there are two main modalities that we look for when we're wondering if a patient suffered a stroke. One is a CAT scan. And a CAT scan is a really quick way of evaluating the brain, literally takes a minute or two. And we use this in the acute setting. Then we also have something called an MRI, which gives us a little bit more detail of the brain and is usually used in the non-acute setting.
And how do you treat a stroke?
So there are two main ways that we treat stroke in the acute setting. One is a clot busting medication. And so that's given by the vein, and that has to be given within the first 4.5 hours of the onset of your stroke. So that's why it's so important to call 911 to get to the hospital as soon as you can. There are other patients who have one of the large main blood vessels inside the brain, like one of these larger ones here, that is closed off. Okay. And when that happens, doctors can go in with a catheter into one of the major blood vessels in the leg and put it all the way up into that clot, and then they can take the clot out and restore the blood flow. That is only available to patients that have a very large blood vessel closed off. So again, this is very important to get to the hospital as soon as you can so that the doctors can go in and pull out the clot and restore blood flow so there's less injury to the brain.
Scripps has been recognized nationwide for providing really exceptional care for folks who have stroke. Talk a little bit more about that.
Yes, so as you know, we have 5 hospitals in our system, and Scripps La Jolla has been designated as a comprehensive stroke center. So, what does that mean? That means that we are able to take care of the most complex stroke patients with technology that is available and physicians and teams that are available only at certain hospitals. Our other hospitals are also certified. Scripps Mercy is thrombectomy capable center, which also allows them to do some higher level care of our patients. And then our remaining hospitals in Chula Vista and at Encinitas are primary stroke centers, which are well certified to take care of an acute stroke patient.
So if you think you're having a stroke, you're calling 911 to get to the nearest hospital?
Yes.
Who makes up the stroke rehabilitation team?
So our stroke rehabilitation team is multifaceted. We have many different types of therapists. We have physical therapists, occupational therapists, speech therapists. Of course, our nurses are extremely important. And then running the team is our PM&R physicians or neurologists who help guide the treatment of these patients.
And how long does it take to come back from a stroke to be rehabilitated?
Well, it really does depend on the location of your stroke and how large it is. But people can continue to improve from their stroke even up to a year after they've suffered the injury.
If you have a stroke, how long are you in the hospital?
Again, it really depends on the size of the stroke and the deficits you experience. So there are some patients that have very mild strokes and they can be discharged in a day or two. And then there's other patients that require help with their breathing, help with their eating. And so those patients will take much longer to be in the hospital. And then from there, they will be transferred to an acute rehab facility where they can continue their rehab.
Can you do things to actually prevent having a stroke?
So the most important things to do is make sure your blood pressure is under control, make sure your blood sugars are under control, make sure that your cholesterol is under control. Also, being physically active, being involved in an exercise program, very, very important, as well as making sure you follow a Mediterranean type of diet.
And that's what?
Well, that's to, limit the amount of red meats that you're eating, increase your vegetable intake. And those would be the important things to try to help decrease your risk of stroke.
If you've had a stroke, um, what can you do to prevent having a second stroke?
So the important thing is to figure out why you suffered the stroke in the first place. And that will really guide us to determine how we do prevention. But many patients really, again, need to be sure that their blood pressure is under control, their cholesterol is under control. They're taking any what we call blood thinners, whether that be aspirin or other types of blood thinners, making sure your blood sugars are under control. So those are the main things we need to do for prevention.
Any final thoughts, doctor?
The most important thing to understand is time is brain, and we need to know the signs and symptoms of stroke, which are B, balance, E, eye, F, face, A, arm, S, speech, and T, time, because the faster you call, the more likely you are to have less disability, and it could actually save your life.
And save your quality of life.
Yes, and your quality of life, absolutely.
Thanks so much, Dr. Kalafut. We appreciate you taking the time.
It was my pleasure. I enjoyed it.
If you want more information about strokes, just click on the link or go to scripps.org/videos. Want more critical information about your health? Please subscribe to our Scripps Health YouTube channel and follow us on social media at Scripps Health. At Scripps, we're here for good. I'm Susan Taylor. Thanks for joining us.